Patrick Kuma-Aboagye, the Director General of the Ghana Health Service there. A very busy man and a very important man in this country, in this time in our lives. Good morning to you and thank you for joining us. And I apologize that we delayed a bit in bringing you on.
Thank you and good morning.
Yes. And I was saying that we've been trying to get you into our studio since January. And knowing your schedule and what you have to deal with on a daily basis, and you're everywhere really, giving the country updates, it's been difficult, but we are happy that today you're here.
Well, thank you. I think one of our key jobs is to also educate the people, and also these are good opportunities. When we have time, we take advantage of.
Great, and we appreciate that. So we'll start with an update from you. We've got the figures from the Ghana Health Service website. We'll put that up, but if you could also give us an update, just briefly, the situation on COVID, the case count. And this week, we know that we recorded the highest number of deaths. We'll get into that a bit. So maybe give us the update first.
Well, thank you very much. Maybe the update I have here may be slightly different from what you have on the website. This is yet to be updated. We currently have recorded we have an active case count, which is dropped from the 8,000 to about 6,567.
Okay.
When you see a drop, what it means is that the number of cases reported that day is less than those who recovered. That's when you recover, you start seeing the drop. And that's why we have moved from the 8,000 plus to about 6,567. And it looks like the current one has been uploaded, and so that's what you have, with about 572 deaths.
Yes.
Bringing our death rate to about 0.7%, still way below the global average of 2%. As you can see, we have about total 70.
If we could, just attention to my producer, if we could put the numbers up to help. Yes, thank you.
A total of 79,655 cases so far, and we have done a lot of tests. In the last month, when there's a surge, the number of tests has gone up. So far, we've done about 862,000 deaths. And so those are the key factors that I want to put out. The number of cases who are on admission, those with severe, about 92. You see, there was a time in a month that we had about 148, 160. The critical cases are 28. These are not slow, but compared to 2-3 weeks ago, it's slower. But these are still very high compared to the numbers we're dealing with in 2020.
Okay.
So that's the situation broadly around. We are seeing some reduction in the cases in Accra. Like today, we are reporting 187 cases in Accra. Accra was reporting 500 plus on a daily basis. But that also shows us that if we adhere to the protocols, as the use of masks move from 10% to 52%, you can see the decline in the transmission. And so that shows that protocol is extremely important. What we are worried about is that people are not wearing it in the night. You have a very high use in the morning, it drops a bit in the afternoon, and in the night it's about 26%.
What reason did you find? Is it because people are exhausted, tired at that time?
Maybe, but maybe. It may also be that we have a different cohort of people who move out in the night. More likely to be the youth, and so we need to focus on the youth and adherence to the masks. And so these are the things we are looking at, how we factor our messaging to them, because that is very crucial, and that's a time that we can also be transmitting. That's where people are drinking, people are closer together, and the transmission may be higher around that time. Okay,
I'll stay a little on that because I'd want to find out then. Yesterday you talked about the active cases per day, but you said that the active cases were not increasing, but they were high. Yes. I guess that's a very technical language. So maybe if you can explain, you said they were high, they were not increasing, but high at a stagnant point. So maybe in layman's English, maybe you can explain that for us.
So what we mean is that, the active cases at one stage was about 300, just less than 400, just in early December. and then we went up. But you see, the highest we had ever reached was about 5,000 during the June-July peak.
Okay.
But now we are talking about 8,000. We are dropped from 8,000 to 6,500. It is still higher than our previous situation, but even that the first wave. What I mean is that it is declining, but it's still very high. What it means is that we have about 6,500 people who are carrying the virus who have to be taken care of. And that is what I mean. So it is dropped. It remained stagnant for a while, and the last started dropping slightly, but it is still very, very high number compared to what we know.
Okay. I must say that we have another guest joining us. That's a nutritionist, Akosia Nyame Adom Frimpong. She'll be coming in at some point for us to talk about how we should be eating around this time of the COVID. But Akosia, good morning and thanks for joining us.
Good morning.
Great. Doc, I'll come back to you. So you also talked about 556 cases across the regions. This is focusing on the schools. You've got 556 cases across the regions since school reopened in mid-January. This is out of 139 schools. Is that a good or bad thing?
Well, I mean, even one case is bad, but you have to do the comparison. We have open school for about 9 million kids. Obviously, there's this 556 is a test, but the same is a community. And so if you look at the number of cases we have had, and especially when we anticipated that in the first 3 to 4 weeks of reopening school, we are going to have a number until the protocol, people get used to the protocols, until those who are coming from the homes, especially the boarding houses. If you come from the house and you have positive and you are contained, after 2-3 weeks, you can see some stability in the school. The difference is in the primary schools where it's a day school. But looking at the number and looking at the fact that we are having about 5% of all these 79,000, about 5% of them are children. This is way, way, way lower. So in a way, one would say that even the schools are safer than at home. And let's not forget that when you close school, these kids are not going to their homes. They are in the communities. They are in the markets. They are everywhere. So they still face the same risk just like anybody else. And so I believe, and we still believe, that the school still provides a much, based on the protocol that have been put in place, provides a safer environment for the kids, at least looking at the numbers that we've had. And mind you, these numbers you're talking about 80% of them, 80 cases came from one school.
Okay. Because
of an outbreak, and it was clear that protocols were not in place. Now we've gone in there, we established the protocols properly, and things
that
are
appears
working.
to be a good sign. If
Yes.
80% are just from one
No,
school.
80 of them.
80 individually, okay.
Yes, one of the
from one
139 schools, one has provided about 80 cases.
80 cases.
And so that tells you that some of the schools are 1, 2, 3 here and there. So that's what I'm saying, it's safer environment.
Very well.